Good morning. I'm Kirby Jordan, and I'm the Vice President of Member Services and Communications for Roanoke Electric Cooperative. And we're excited to be here today for our third webinar. And we are partnering with the Institute of Emerging Issues. And we're very happy to partner with this team because we noticed that we had very similar goals. We're very passionate about bringing the internet and education about internet to rural North Carolina. We decided we would combine efforts with IEI, and we would be able to bring more resources to our region. So we had joined with IEI, and we're going to do these Broadband and Beyond series as we did in the past as our Straight Talk forums. We did those in the previous years, but because of COVID-19, we had to bring this meeting to you virtually. So it's been working pretty well. This is the third session we've had, and we've had a lot of great people come in and join us and ask some good questions, and we want to continue that process today. We have a chat function at the bottom of your screen, and we'll be monitoring those chats as they come in. So please feel free at any point of any speaker, if you have a question or concern, to just write it in, and we'll try to answer it live because we really want to address your concerns at the moment. We are also recording all these sessions. The previous meetings are posted on RoanokeElectricCooperative.com, and this session today will also be posted. So if you have any friends or family that need to know this information, they can always come back and listen to the recording. We've got a great lineup of speakers today. The topic is telehealth, and we know this is a big issue here in rural North Carolina. So we hope this will provide you some guidance and some information that will be helpful. I did want to give you an update. Many people have asked us about Roanoke Connect. Roanoke Connect is our subsidiary of Roanoke Electric Cooperative, which will be bringing broadband to the area. And our installations right now have been curtailed. We have taken a different strategy, and we think it's one that is going to be stronger in the long run. We've decided to bring fiber to the premise, and you can imagine this is a really large undertaking. So we've had to pause and work with our new engineering firm, but we promise in the long term, it will be much better service that'll be faster and more reliable. It'll be able to provide you with more products and services that will put you in a better position for the future. We appreciate everybody's patience. We know it's been a struggle. We understand your concerns, and now we hear it even louder. And we just want you to know that we are working as fast as we can. And if you'd like to sign up on our website, some of you have registered already to join Roanoke Connect, but you can simply go to www.register@roanokeconnect.com, and that is a sign-up sheet where you can let us know where you are and that you'd like broadband services. And then we will waive the installation fees if you sign up in advance through June 30th. So we encourage you to do that. This service, again, like I said, we really feel like we're going to be at a position that we'll be able to expand and offer more. So we appreciate your patience. I just can't say that over enough. Our construction's to resume in October. So you might be seeing our trucks out in the field, and Vantage Point Solutions, that's our partner. We just wanted to let you know that. And we know that right now during COVID-19, there's a big urgency for broadband. So in the meantime, Roanoke Electric and Roanoke Connect have provided 20 hotspots throughout our service territory. These hotspots are free, they're high-speed internet, and then you can go there and do all the different tasks you may need to do. We have those listed at RoanokeElectric.com on the website as well, so that you can find out where you can go and have this free access. You simply drive up in your car, get on your laptop or your tablet or your smartphone, and there's no password required. But this way you can finish up the schoolwork that may be needed for your children. You can apply for jobs, apply for those stimulus checks, or apply for unemployment. And we felt like we needed to roll this out very quickly. So this is available, and I hope you can find one that's close to you and you can take advantage of this free service. But we wanted you to know that information. And then, like I said, our topic today is telehealth. We have 3 great speakers who are going to talk about this subject. And the first speaker is Leslie Boney, who we've been partnering with, and they've been such a great partnership, and we've enjoyed doing these webinars, and we hope to continue and do more across the North Carolina region to help spread the word, spread the education and the information about broadband. So Leslie, it's with great pleasure. I'd like you to kick it off.
Kirby, thank you so much. And we're honored to be in partnership with Roanoke Electric. The co-op has shown leadership on so many issues over the years, and this is yet another one where you're stepping forward and really taking an issue that has been lagging and poking along for 20 years and really jump-starting it and moving it forward in an important way. So this series of webinars is really exciting to us, and honestly, we're hoping to learn from these webinars about how we can take the innovations that are being pioneered in the Roanoke Electric area and spread them throughout the state to other rural areas that are struggling. We are part of a great challenge right now, which is how do we connect at a time when we are disconnected? How do we do that in order to help school children learn at home? How do we do that so that people who are being asked to work from home can successfully do that? And today, we really focus in on how do we help people get health care from home. This is an issue that has been struggling for so long in the US, and there have been disagreements about who provides the health, how they do that, how they get reimbursed, at what rate do they get reimbursed? Is it fair for people who don't have access over the internet to do this? And when COVID-19 came, a lot of those issues that we've been arguing about forever went away, and very quickly, as part of a stimulus package, there were $300 million worth of aid given to rural healthcare providers across the country to begin doing this. And I just share one data point about telehealth. And that is, in the places where there have been extensive experiments about it, it really has been found to address a lot of the issues related to both rural healthcare, but also the spiraling cost of healthcare. So I'm looking at one study done at Frederick Memorial Hospital in Maryland, where they launched a patient monitoring telehealth program. And they found that over the first 6 months, it cut the number of emergency room visits in half. It reduced hospitalizations by nearly 90% and cut the overall cost of healthcare by 50%. And I'm not saying that those numbers are the same that we would see necessarily all over the country, but just based on my mother, last 6 months of her life, she called EMS to take her to the hospital 6 times. And each time when she got there, they found out she was fine, but she was worried. And the only way she knew to get attention was by calling 911. And I think had she had available to her telehealth, she could have just talked to a doctor who could have reassured her that everything was going to be fine. And it would have saved her huge amounts of money. It would have saved the healthcare system a lot of stress and worry. And so I think this crisis is giving us an opportunity to think about telehealth in a new way as not a replacement for the traditional face-to-face healthcare system, but instead as a complement to it, as something that we're able to add to that to help with some elements of the healthcare system. And in rural areas, I think it's particularly important as we see healthcare in many cases move further away from those who need it. So really excited about this topic, and I'm going to turn it over to my colleague, Maggie Woods, who is leading this project for us statewide. Maggie?
Great. Thanks so much, Leslie. Thank you for the kind introduction, and a huge thank you to Roanoke Electric. This has been such a fabulous partnership, and really enjoyed partnering on this Broadband and Beyond series. So as Leslie really eloquently laid out, today we're talking about telehealth, and specifically telehealth in response to COVID-19. And I think he hit the points of why this matters. But today we're going to be talking about what is telehealth, how can you access it, and then what are providers and patients seeing in terms of some of the challenges and opportunities that telehealth can offer right now? And of course, all of this will be under the lens of connectivity. This is a Broadband and Beyond series, after all. So we have 3 fabulous guest speakers today, 2 guest speakers from the North Carolina Office of Rural Health who will kind of paint a picture of what's happening in North Carolina at a state level. And then we have a local provider who'll be talking about what is happening in Northeast North Carolina. But I do want to just start with some statistics to make sure that we're all on the same page today. today and have a sense of not only where North Carolina was in terms of broadband access and adoption before the pandemic, but also some quick telehealth statistics as well and how it's growing. So if we could get the slide up, great. That shows these statistics. So just quickly, there are several different components to access to broadband. So it's both access to broadband as well as subscriptions. Are people subscribing and adopting broadband and internet access? And then do people have the devices that they need in order to connect to the internet? So in terms of access to internet services, and we went a little deeper in this in previous webinars, but we know that there's about 261,000 households in North Carolina that are underserved when it comes to internet service providers. So this either means they don't have an internet service provider in their area, or that service provider doesn't provide service to their household. And we know that the majority of these underserved households are in rural places, much like northeastern North Carolina, where many of you are calling in from. And this is something that Roanoke Electric is working on with their Roanoke Connects program. But access is not the only statistic that we look at. We also look to see if people are subscribing to the internet, if it is available to them. And reasons why people might not subscribe, a big one is affordability. We all know that internet is expensive, and if you can't afford it, then you're not subscribing to it. Another one is relevancy. Do you see the internet as relevant to your life? Now, this might be changing. We're all seeing the internet as relevant to our lives in ways that we didn't understand before. But this is pre-pandemic statistics that I'm showing you. And then third is whether people have devices to connect to the internet. So in terms of subscription, we see that pre-pandemic, about 22% of people didn't subscribe to any kind of internet at any speed. And pre-pandemic, about just over 40% of people didn't subscribe to broadband, which is what we consider high-speed internet. And in terms of devices, just about 25% of North Carolinians pre-pandemic lacked access to a desktop or laptop. And the reason why this statistic is important is that it's really hard to do your homework, to apply for a job, to work remotely on a cell phone. So that's why we look at statistics around access to a desktop or laptop. And then we see that just under 9% of North Carolinians only had access through a smartphone, which again may not meet the needs of every single person. Another issue with smartphones is data limits. If you have data limits and you're using your smartphone as a hotspot, or you're using your smartphone to connect to the internet to do your work, your data limits may kick in pretty quickly, and then you have substantial fees if you go over them. So now that we've kind of walked through some broadband statistics, I just want to quickly walk you through some of the increase of telehealth statistics. So if we could go to the next slide. We know that the number of telehealth practices, or practices that reporting seeing patients by telehealth, is growing substantially. So more than 80% of practices report conducting telehealth visits since the pandemic hit. 44% of practices report that they are conducting more than a fourth of their visits via telehealth, and 28% of practices report that they're conducting more than 1/2 of their visits by telehealth. So we're going to dig into this a little bit more with our guest speakers. So I'm really pleased to introduce our 3 fabulous guest speakers today. So we have 2 guest speakers from the Office of Rural Health, Lakeisha Moore, who's the Health Information and Technology Program Manager, and Nick Galvez, the Rural Hospital Manager. And then we also have Kim Schwartz, who's the CEO of Roanoke Chowan Community Health Center. So we're so thrilled that the 3 of you are here today. And we're actually going to start with Nick and Lakeisha. So you both are from the North Carolina Office of Rural Health. Can you tell us a little bit more about what your office does and some of its mission? And Nick, I'm actually going to go to you with this first question.
Sure, yes. Just wanted to make sure I can be heard.
We can hear you. And if we could
Great.
get that next slide up as well, that would be great.
So on the slide there, it talks about our Office of Rural Health. So I will share that we are a division within the North Carolina Department of Health and Human Services. The mission, as you can see on the slide, and I'll summarize, is to offer funding, training, and technical. And those aspects are with telehealth, either directly or indirectly. There are 9 programs within the Office of Rural Health. However, two of those programs are more directly involved with telehealth, which we'll highlight today. And those are the Rural Hospital Program and the Health Information Technology Program. So I'll shift and talk a little bit about those programs, which is in the upper right-hand corner there. The Rural Hospital Program supports critical access hospitals. Many of those are located within rural communities. Also supports some of the smaller hospitals, and those are hospitals that are 49 beds or less that are also in rural areas. These two programs are federally funded through the Health Resources Administration, which is a part of the federal DHHS. And then the third program that's part of the Rural Hospital Program is the State Telepsychiatry Program, which I'll talk a little further about that later in the presentation. And this is a state-funded program funded by the North Carolina General Assembly since 2013. And this program is administered by East Carolina University and their telepsychiatry program. However, it is monitored, and the Office of Rural Health provides oversight and legislative reporting for this program. The Health Information Technology Program at the Office of Rural Health provides technical assistance to providers to start telehealth programs and provide other telehealth-related activities. One of the recent collaborations is with the Office of Rural Health and the Department of Information Technology to assess telehealth in 20 of the most western North Carolina counties to assess the feasibility of starting telehealth within those counties.
Great, thanks, Nick.
Updates on the mission and vision.
That's really helpful. Thank you, Nick. And you know, we're talking about telehealth here today, but could you define telehealth for us as we think about what telehealth looks like in North Carolina?
Sure. So on the slide that we'll bring back up, there's 4 broad categories of telehealth, as you can see on the slide. I'll just go ahead and talk while it's coming up. So the first category is mobile telehealth. And the other categories are store and forward, remote patient monitoring, also referred to as RPM, and video conferencing. Those are the 4 broad categories of telehealth. And I'll talk about each one of those categories so you understand how they fit in the large picture of telehealth. So mobile health is often referred to as mHealth, and this refers to mobile communications with devices to address healthcare. So this is a very general category. The store and forward is transmission of recorded health data through electronic communications to a healthcare provider for that clinician or that provider to review at a later time. So the difference between the top two is those are done at a later time, and the clinician and the patient and the data is connected, not in real time. Whereas remote patient monitoring is collection of personal health and data of a patient in one location that is transferred electronically to a provider. So that is real time. The provider or the office is able to respond to that data if, for example, the blood pressure, heart rate, or the patient shows a spike in their temperature. The office or the receiver of the data can respond in real time. And I know Kim Schwartz from Roanoke Community Health Center will be talking about remote patient monitoring a little more in detail. And the final category is video conferencing. This is most commonly understood as telehealth because it's such as FaceTime, Skype, WebExes. It's live video conferencing. It's what's referred to as synchronous, where the patient and the clinician can see each other's reactions, hear voices in real time. Some of the software technologies that are currently available for that are Zoom, WebEx, Microsoft Teams, which we're using today. One of the state-funded programs that I'd like to highlight is our state telepsychiatry program, which you'll see on the lower right-hand corner. That's a graphic representation of really the eastern part of North Carolina. And this program is based out of Pitt County, which is where that star is. The program uses video conferencing to meet patients within hospital emergency departments that are experiencing an acute mental health crisis. Many rural hospitals and some urban communities do not have access to a psychiatrist, and the state-funded program allows hospitals to access those specialists within hours in those hospitals. And this prevents patients being transferred to other hospitals where psychiatrists are available. And this is just one example of how the networked system of telehealth works well. And beginning in 2019, this program expanded into health departments. And if you are able to zoom in on the map there, those blue diamonds are health departments. Several of those are in Eastern North Carolina. Many rural hospitals also have telestroke programs, which can reach a specialist that can save lives by reaching patients hours before they arrive at that stroke hospital.
Great. Thanks, Nick. And it's really interesting to hear the different kinds of telehealth. I think for many of us, we just think of video conferencing as the only way that telehealth works. So I appreciate walking through those different definitions. Lakeisha, I do want to move to you. I shared a little bit about the increase of telehealth since the pandemic, but can you talk a little bit more about how telehealth service has changed since COVID-19? I think we can bring up that next slide now as well.
Great. Thanks, Maggie. And thanks for having us, Kirby, and the team there. This is definitely an exciting topic for Nick and I. Both of our programs work pretty closely with telehealth, but you'll see the slide on the screen, kind of top left part of
Are we
this slide.
supposed to be able to break in?
Uh-oh, I hear somebody else talking there. But so the top left slide shows just how, amid the COVID-19 pandemic, we've seen a huge surge in the amount of telehealth, especially from providers. So our Office of Rural Health, and the HIT team that I oversee work with what we call safety net providers. Those are those providers that primarily are primary care providers throughout our state that see patients regardless of the ability to pay. So we've seen tremendous growth, Maggie.
That's really helpful. Thank you, Lakeisha. And I'll just say I did hear someone break in. If you do have a question, you can type it in the chat box. You can also raise your hand, and we can have you ask a question, but prefer that you type in the chat box so that we can take your question and make sure that it's answered. So Lakeisha, I think many of us are wondering from an individual level, we need to see our doctor, but we're a little nervous about going in person right now. And so could you explain how could I find a telehealth provider, and how does that work with insurance? I think there's just a lot of confusion right now.
Yeah, great question. And I would say start with your primary care provider and see if they are now seeing patients via telehealth. I mean, as Maggie talked about in the beginning, and we shared some of the statistics that we have from the Division of Health Benefits, now up to 80% of providers are utilizing some type of telehealth, and that was a primary care survey. So we know in our state that many providers are beginning to see their patients this way through telehealth. As Nick described, a lot of them will do live videos similar to what we're doing today. They may even use the same platform that you're on today, so you're getting good practice in. But start with your healthcare provider, and then also your insurance carrier. Many of the bigger insurance carriers do also offer telehealth services that are available right now during the COVID-19 pandemic for free. You can actually see a provider through your health insurance carrier. And then also, if you don't have health insurance, many of the free and charitable clinics that Nick and I work with very closely, they actually will also see you via telehealth too. So a lot of different providers out there, whether you have insurance or not, are seeing their patients this way through telehealth.
Great. That's really helpful, Lakeisha. We've talked about how you can access a telehealth provider, but I'm curious, what major challenges are you seeing in terms of being able to access telehealth, or that providers are having? And then after that, what are the opportunities?
Great. So I'm sure Nick and I can probably both chime in on this one. I'll kind of get us kicked off. I think one of the challenges that we've seen, and it's funny, it's become a challenge and an opportunity at the same time. Challenge kind of pre-COVID-19 was reimbursement for telehealth. It was pretty specific. A lot of the rules, especially from the federal perspective of Medicare, and even in our state, NC Medicaid, you could do live video for the most part via telehealth and get some type of reimbursement. But when it came to those other types of reimbursement, and I know Kim is going to talk about this a little more, Kim Schwartz, with remote patient monitoring, that was a little trickier to get paid for. And then depending on the type of clinic that you were, if you were a federally qualified health center, there were some rules in place where you could only act as what's called an originating site where the patient is. So anyway, there were a lot of rules around the reimbursement and just how you could utilize telehealth pre-COVID-19. What we've seen now is there is really a broad reimbursement opportunity for providers out there. So that's definitely exciting. And I'm hoping that, a lot of this will stay around even as we kind of go post COVID-19, where patients are still able to access their provider through telehealth. One other big challenge and opportunity, I'll say, has been exactly what we're talking about today, just the access to digital resources. But then I think the other piece of that is many times, even as patients and providers have access to, okay, great, I've got a computer with a camera and I can get up and running on Zoom or MS Teams. The other piece of that puzzle is feeling comfortable, really understanding like, okay, well, where do I click, or how do I do this, or how do I do that? So I think there's definitely an opportunity for some more digital literacy training to get patients and providers comfortable with using the technology. And I'll turn it over to Nick, because I know he's probably seen some of the same opportunities and challenges.
Yeah, I'll just add to Lakeisha on the reimbursement side. From the federal level, there's been CMS for Medicare patients has been very supportive of video conferencing, but less so of the other telehealth modes like Storm Forward and remote patient monitoring. But I will say during this COVID pandemic that North Carolina Medicaid has opened up a lot of doors for telehealth. So that's a challenge. Now it's an opportunity. The bad news of that is that the window was really open during the pandemic. So after that, all those opening of codes and telehealth services in North Carolina Medicaid may or may not continue. I do know that the department is very excited about the fact that a lot of patients are getting healthcare that they have needed through telehealth. So I do think moving forward, there's going to be a lot more telehealth because it's working really well during the COVID pandemic.
Great. And I'm really glad you mentioned, digital literacy or lack of digital skills, because if we think about what is really important for an individual, it's not just access to the internet, it's not just the device, but it's also being able to use that device in order to meet their needs, in order to see their doctor. So that's a really important point that you brought up. This has been a fascinating discussion with the two of you. I did want to just give you a moment to say anything else that we didn't get a chance to talk about before we move on to Kim. So is there anything else that you'd like to add? Lakeisha, maybe start with you.
Yeah, so also on the slide on the screen, you'll see some of the other state HIP projects that are going on that are funded through the state. Of course, telehealth is a big one that Nick and I at the Office of Rural Health have been involved in. Additionally, we have NC Health Connects, which is a statewide health information exchange. So what that means for patients is when you go to see your primary care provider, maybe if you've also seen your cardiologist here in the state, that both of those providers are sharing your clinical information safely and securely so that they can access all of your information in one patient record. So many times, even when you go to your provider, you may be surprised that, oh, I was just with my cardiologist. How do you already have my results? One way that the state is kind of helping enabling that sharing is through the NC Health Connect statewide health information exchange. So that's one. And then two is NC Care 360, which you'll also see on the slide there, which is what I call community information exchange. It's a way that if patients are having challenges with housing or employment or food insecurity, transportation, there is a statewide electronic resource system, also secure, that is being set up where providers can begin referring patients to those different resources, and providers will get feedback on, whether the patient was able to access those services. So a lot of investment in technology. So really excited about the partnerships with those at Roanoke Electric and beyond to make sure that folks are connected and can access these resources.
That's great. Nick, do you have anything else that you'd like to add that we haven't discussed?
Yeah, I'll just hit a little bit on some of the healthcare needs within North Carolina. Our office is what's called a primary care office. So we do track the needs for primary care, dental care, and mental health within North Carolina. So of those three, all of them are lacking. But of the 100 counties, 93 of those our mental health shortages for health professionals. So just to encourage everybody, if you have any mental health needs, you can reach out to your local health department. North Carolina during the COVID-19 pandemic does have a free mental health crisis line. You can find that on the DHHS website. And just want to put a plug in for that because that's a real big need prior to pre-COVID. And it's only getting worse with everybody being isolated and quarantined during this time during the pandemic.
That's a great resource to uplift. Thank you, Nick. And we'll try to get that put into the chat as well, so you all have direct access to it. Actually, if we could get into the next slide, I just wanted to put up how to contact the two of you if people have other questions. The work that you're doing is really important, and I want to make sure that people know how to reach you if they need to. And so if you guys just stay on the line, I think we're going to move over to Kim. But Kim, before we turn to you, I just wanted to reiterate that if you do have a question, please put it in the chat. And I meant to do this at the start, but I like to start these with a roll call so that we know who else is on the line. So and kind of get the chat going. So sorry we didn't do this at the start, but if you all could on your computer just type in your name and maybe where you're calling in from, what city, what county, what town, that would be really helpful to us as we see who's on the line. So you can go ahead and do that right now. Say some hello. But Kim, let's turn over to you. We're so happy to have you here with us this morning. So Kim, you run the Roanoke Chowan Community Health Center. Could you tell us a little bit more about that center and what populations you serve?
Sure. Good morning, everybody. You can hear me okay?
We can hear you perfectly.
Oh, great. Just doing that lovely test. Yes, thank you so much for the introduction, and also a big shout out to the Office of Rural Health Partners. So Lakeisha and Nick, there's hardly a week goes by that I don't talk to one of them or somebody at the Office of Rural Health, and they are one of our lifelines out here in the